Imagine experiencing temperatures hotter than the surface of the sun right here on Earth. Yes, that's exactly what happens in the first moments of a nuclear detonation. In the first few seconds of a nuclear blast, extreme heat radiates outward. The shock wave begins. Blast wave is highly compressed, superheated air moving faster than the speed of sound and radiating outward as the primary destroyer. Temperatures inside the fireball can exceed 7,000 degrees Celsius. For comparison, the human body maintains a temperature of only about 37 degrees Celsius. So we start with the brain, the nervous system. Traumatic brain injuries and concussion can lead to unconsciousness, memory loss, and long-term neurological effects. The combination of intense light, pressure, heat, and psychological shock places enormous stress on the nervous system. Confusion develops rapidly. The brain struggles to process an event unfolding faster than human reflexes can react. At 0 seconds, the flash appears. The retina, the light-sensitive tissue at the back of the eye, is suddenly bombarded by overwhelming light and radiation, causing retinal burns. The result? Temporary blindness to permanent vision loss. Even people who are not looking directly at the explosion can experience flash blindness lasting seconds to minutes. The ears are extremely vulnerable to sudden pressure changes. As the blast wave forms, the atmosphere rapidly compresses. When the shock wave arrives, eardrums can rupture instantly. Victims may hear a deafening crack followed by ringing, muffled hearing, or eventually complete silence. Then comes the cardiovascular system, the heart and the blood vessels. Blood vessels can rupture under extreme pressure. Sudden shockwave forces disrupt circulation throughout the body. Severe trauma and blood loss may rapidly reduce oxygen delivery to vital organs. Result: circulatory collapse and cardiac arrest. The blast wave striking human body like an invisible wall will cause rapid compression and decompression of the lungs that can tear apart the lung tissue. Tiny air sacs known as alveoli may rupture. Internal bleeding can begin within moments. Result: respiratory collapse. Hollow organs such as the stomach and intestines are especially vulnerable because they contain air. The blast wave can cause tearing and internal rupture. Symptoms: severe abdominal pain, bleeding from mouth and rectum, and ultimately collapsing due to blood loss. Thermal radiation can cause severe burns in seconds. 3 types of burns can occur. First-degree burns are extremely painful because nerve endings are exposed. Second-degree burns are characterized by blister formation. Third-degree burns penetrate deeper, destroying structures beneath the skin, including nerves. Paradoxically, a third-degree burn may feel less painful because the nerves themselves have been damaged. Hair can ignite almost instantly under such extreme heat. Now, let's explore a different possibility, a future where nuclear weapons are absent from warfare. There will be no nuclear attack in future, because a single nuclear strike can threaten life across half the planet. No nation is willing to unleash or bear in return such catastrophic consequences. Proof: despite tensions, countries have avoided a nuclear war for the last 80 years. Team Sage Musician wishes to see this world as beautiful as it is, free from war and violence. Our planet Earth is stunning. Let's together make it more livable. Our planet is a treasure. Let's nurture it, celebrate it, and make it a better place for all. As a health educator, I want you to know that all the content on this channel is sourced from credible references. Leave a comment and share your feedback. Your engagement helps us all learn and grow together. Subscribe and support the channel.